Hello, I'm Dr. Robert Eckenberg.
And I'm Alex Millspaugh.
Alex and I work together, and we are here to talk to you about chronic pelvic, genital, and sexual pain. I was an obstetrician and gynecologist for over 30 years before I began focusing my practice on chronic pelvic and sexual pain disorders beginning in 2001. Before we get started, we believe it's important for you to understand exactly what pain is, how it's processed in the body and the mind, and how knowing this can help you manage and cope with your pain. As we often tell patients in my office, I work from the bottom up.
And I work from the top down.
Hello, my name is Karen Liberi. I am a certified women's health specialist and have focused on treating pelvic pain for the past 16 years. As Alex and Dr. Eckenberg have stated, pain needs to be addressed from the bottom up, meaning treating localized reaction to pain responses, as well as from the top down, meaning understanding the nature of your pain to better put into context what you are feeling and then begin the healing process. From the physical therapy standpoint, we will integrate these two approaches to assist with minimizing your pain. Some patients wonder why I want to instruct them in use of dilators to help with decreasing pain with intercourse. Dilators will be discussed at length later in the DVD. Some may even ask me, why do I need your assistance if I can just use my partner as the dilator? Won't that accomplish the same thing? Now that is the perfect scenario to introduce the concept of integration of top-down and bottom-up approach. My answer would be this. If you continue doing as you have been doing, having sex that is painful, then by setting yourself up in that same environment with your partner will perpetuate or reinforce the pain because your mind is already anticipating the pain. It is a known response. Now, if we remove the red flags from the brain and place you in control using the dilators, we can retrain the brain to realize that there doesn't need to be a fight or flight response. We can begin to unwind the nervous system. When you start with an extra small dilator and can insert and move it and do self-stretches with low to no pain, then the brain starts to realize that, okay, that wasn't so bad, and the secondary responses of muscular tensions ease. This also allows for less pain and improves your overall confidence level with repeated successful sessions with a dilator, which also allows you to become ready for return to intercourse with low to no pain. So essentially what you have done is change the perception in your brain about the health of your vagina and decrease the sensitivity of your nervous system to keep the muscle tension in check to help achieve a good end result. In addition to the dilator work, there are other exercises that can be performed, such as flexibility work to the hips and trunk, relaxation breathing exercises to quiet the nervous system and muscle tension, and functional integration exercises with focus on pelvic floor muscle activation and relaxation. Certain exercises that promote elevated tension of the pelvic floor will need to be avoided at first, and this will be reviewed later in the DVD.
You see, when you understand how pain is processed in the body, you will understand how important it is to integrate both mind and body aspects of your pelvic and sexual pain. So let us begin by explaining pain.
What is pain? Pain is the alarm system or warning system in the body. So-called acute pain is essential for our survival. We need to know if we step on a nail, have a heart attack, or injure ourselves in other ways so we can properly be warned. When we are in danger, we need to know instantly so we can make moves to protect ourselves as quickly as possible. This is why our nervous system is similar to an electric circuit. The signals from the injured area travel through the nervous system to our brain and trigger the alarms to go off. This process happens almost instantaneously, but it is a bit more complicated than that. When these signals generated from injury are interpreted as painful or dangerous, our fight or flight response kicks in. This is called the sympathetic phase of the nervous system. The opposite is the parasympathetic phase, which is the calming, restorative phase of the body's nervous system. The sympathetic phase, or fight or flight response, is an evolutionary protective response which leads to physiological changes such as muscle tension to give you strength to fight or run away, increased heart rate and blood pressure, shallow and rapid breathing, sweating, and other autonomic nervous system responses, such as dry mouth, slower immune response, and inhibited digestion. During this response, your brain is also checking in with other parts of the body as well, always with the intention of protecting itself.
When signals from all of our senses and from all parts of our body travel towards our brain, they are influenced along the way at various levels of the nervous system before being processed and interpreted by the individual. We may feel a twist of our ankle, for instance, in different ways under different circumstances, because that signal also travels to the parts of the brain where previous experiences, memories, and knowledge of our bodies are stored. In fact, recollections of all of our senses, including sights, sounds, touch, smells, and tastes, are all stored indefinitely in many locations in our nervous system, and ultimately all of our ongoing experiences are therefore processed and interpreted by a constantly vibrant and changing network of connected combinations called neurotags that together form the overall concept known as the neuromatrix.
Understanding this concept of the neuromatrix helps us understand how our nervous system tells us different things under different circumstances, almost always to protect us, by signaling to us how to react at any given moment, with what it, the nervous system, thinks it knows at that very moment. Scientific research from many parts of the world is beginning to help us understand how this neuromatrix of ours allows us to give variable meanings to pain and suffering. Commonly determined by the accumulation of our past experiences, those we remember and those we do not remember, as well as our acquired beliefs, thoughts we focus on throughout the day, our emotional state, and our overall understanding and perception of the situation. As you may have seen in functional MRI images in magazines, the neuromatrix can be conceptualized by seeing on those MRIs all the different parts of the brain that light up in different colors and locations when there are signals and triggers being set off from both inside of the body and from the outside surrounding environment. The nervous system is constantly checking on our neuromatrix to decide how to react in any given situation.
Therefore, the brain decides what is painful or not, depending on our brain's perception and understanding of the situation. This process happens in microseconds without our conscious control. This process can decrease or increase our experience of pain, depending on the perceived danger level of those signals. Understanding long-term muscle and nervous system memory is not hard when picturing an expert violinist or figure skater perform. They rely on practicing the same routines for years until they do not even have to think about the mechanics of performance. Likewise, the reactions to long-term cumulative traumas we all experience can be equally automatically replayed, but this time with chronic pain, even long after the original injuries have occurred. Our volume dials get turned up, and smaller amounts of triggers, such as mild touch or body cramping, can be amplified exponentially. In the case of pelvic and sexual pain, these amplified triggers may often be coming from long-term dysfunctions of any of the organ systems in the pelvis or any of the supporting structures. For example, if we trip on a curb and sprain our ankle, will it hurt? Yes. However, if we trip on a curb and sprain our ankle but we have a big bus coming towards us, are we going to feel that pain in the ankle? Probably not, until we move out of the way of the bus and are safe again. This is our neuromatrix at work, perceiving what is going on around us and determining what is more dangerous in the present moment experience. It is important to keep in mind that our brain's perception is not always accurate and not always in our control. An example of this is a visual illusion.
When most people look at these two lines, their brain determines that the bottom line is longer than the top line because, based on the surrounding signals, being the arrows at each end, the brain perceives there to be a difference and decides for us which one appears longer. Thus, the way our brain perceives things is not always accurate or in our conscious control. and perception changes based on what else is going on around us and within us.
Here is another way to view this concept. You have the trigger that sends real chemical signals to the brain, where it is then evaluated by different parts of the brain, looking at current and past experiences, the environment you find yourself in at that moment, and the perceived meaning behind the trigger, which then sends off another chemical reaction or response of the brain and nervous system. This reaction and response, once again, is based on the main question, how dangerous is it?
In the context of pelvic pain, there are some questions that may arise in response to those signals. Depending on our conscious awareness or response to these questions, the brain either perceives safety or danger. The more our brain perceives danger, the more pain we experience.
It is important to erase the old way of understanding pain and look at the new way of understanding pain. The amount of danger signals that are sent up into the brain, plus the level of threat that is perceived in the brain, equals the amount of pain we experience. So, when talking about chronic pain, it is important to note that chronic pain is not prolonged acute pain. Chronic pain is the result of our brain interpreting signals through our nervous system, commonly long after the actual tissue damage has healed. Triggers of these signals in the pelvic region can include one or all of the following: functional systems, bladder, bowel, or uterus, and even prostate in the case of male pelvic pain; structural systems, muscles and ligaments in spasm; nerves firing, causing tingling, burning, itching, dryness, or even stabbing or aching of surface tissues, all of which add up in our memories, emotions, and thoughts. These signals are also called generators. Usually when generators are sent up to the brain responds by sending down corresponding inhibitors. All of these generators and inhibitors are actually chemical neurotransmitters such as serotonin, epinephrine, norepinephrine, dopamine, and even prolonged rushes of adrenaline. For example, when we stub our toe, it really hurts for a couple of seconds until our inhibitors take over. Our brain immediately tells us that by all of our previous experiences, stubbing your toe is not dangerous, and the pain quickly fades away. With chronic pain, however, the generators outweigh the inhibitors, so the volume of our nervous system signals gets turned up. This is called central sensitization. Over time, the nervous system will respond more and more strongly to a smaller amount of signals. This is one reason why sensitivity related to the external genitals and pelvic floor, for example, can increase over time when not treated or managed properly.
Focused training can redirect the mind in order to help our brains avoid these particular triggers and signals as much as possible. Mindfulness-based stress reduction, diaphragmatic breathing techniques, and physical therapy are proven tools to help guide us through this process. You will be learning these techniques a little later in this video. The more we understand what is going on in the body, how pain or danger signals are processed in the body and mind, and the more tools we have to temper these signals and how they are reacted to in the brain, the more we are likely to reduce the pain or turn the volume dial down.
Access to multidisciplinary care is recommended by virtually all pain-centered organizations to maximize effectiveness in the management of chronic pain. These multiple disciplines include medicine, physical therapy, psychological counseling, nutrition, dietary changes, yoga, mind-body relaxation, massage, and many others. Current research also demonstrates that multidisciplinary care is not only more effective in reducing pain, but also substantially reduces emergency room visits as well as invasive diagnostic and surgical procedures. This type of care, therefore, significantly reduces the overall cost of chronic pain management.